Okay, so the book now classifies a series of muscles called oblique and rectus muscles. We already talked about the scaling muscles in a prior video, and so now what I want to focus on this page is muscles in the thoracic and in the abdominal region. And so we're going to look at these specific ones here. So here's an image, and we're specifically looking at ones that are going to be attached to the ribs. So here we have what's called the external intercostals, and over here we have what's called the internal intercostals. I want to focus on the internal ones first. If you were to take your hands, and just so you know, what you're looking at is you're looking at a side view. Let me get in the same direction here. You're looking at a side view of the ribs. So you're actually coming in from this direction, looking at this surface of the rib cage. And so what you're seeing actually is these fibers are starting close in up here, and then they're moving out that way. So if we were to take our fingers and trace that from top to bottom, our hands do not make an X. Now let me show you the difference between that and what we have with the external intercostals. They're actually starting out here and they're going across this way. And so if we were to actually keep going with our fingers, they make an X. Okay, or you can think about it, they make an X. Alright, so external intercostals make an X, and internal intercostals do not. Okay, these actually lie right on top of each other. So external intercostals actually lie more superficial, okay, and then internal intercostals go the other way, lying underneath them. Okay, and of course they're going to be helping to move and elevate the ribs. And if you think about it, when you breathe in really deep, those ribs move out, and so these muscles help to do that. Okay, now this is actually showing a view from underneath, so we're looking up this way right at the bottom of our rib cage, and so this muscle right here is the diaphragm. If we were to look at it here, the diaphragm would actually be attached to the bottom part of this rib cage, and it's going to go from the front of your body to the back. So it's what separates thoracic cavity from abdominal cavity down deep. Okay, so a couple of other ones. So now let's look in the abdominal area. Okay, and so looking here in the abdominal area, we're going to see a few different muscles. So first of all, we're going to see external obliques. Now let's think about this name. Oblique means if this is the midline of our body, it's going to be coming in at an angle to that midline. Here's the midline, obliques come in an angle. Now just like we saw with intercostals, external obliques, if you start up here on either side and moved your hands along the direction of the fibers, they would form an X. So you'd start at the top and then you'd form an X. Okay. Now external also means that they're the most superficial. Underneath you're going to see, so this little thing right here means we've cut away external obliques and we're looking deep inside. And if we do that, we're going to see here that we have fibers also running at an angle to the midline. They're going the opposite direction. And if we start at the top and go down, your hands actually don't make an X. They go out. Okay? So these are the internal obliques. Now even deeper to that, so here's another window. We've cut away internal obliques. And here is what's called the transversus abdominis. Let's think about this word. Transversus means it's running in this transverse plane. Okay? And abdominis means it's in the abdominal region. Now we also have the rectus abdominis. We've looked at this before. This is going, the fibers are going parallel to the midline of the body, and it's in the abdominal region. Okay. Now in between the right and the left sides, or I should say right side and left side, is a thin piece of tendinous connective tissue. And that's called the linea, means line. Alba means white, so it literally means the white line. Now you may notice in between, all of these muscles are rectus abdominis, but you may notice that there's little patches of tendons in between them. And those are called tendinous intersections. And this is what gives you the six-pack, okay? That little bulging, if you don't have much fat over your abdomen, you'll see bulging bits of muscle. And that's because you've got muscle and then you've got this little bit of connective tissue here that doesn't bulge. Okay. One other thing I want to point out here, this is an aponeurosis. It's a broad sheet of dense connective tissue, so it's like a tendon except for it's not in a bundle, it's a flat sheet. Okay, and so this is the abdominal aponeurosis. Okay, and so I believe that those are the muscles in this region, and so my suggestion is to go through these activities and use them to practice naming. Be sure on something like this, right here, that you notice this means it's superficial, this is in the middle, and this is deepest. So be sure that you're looking for those sorts of things in these images.